With the other one, I do not. But I want to get a good look in here, and you can see this ulcerated crater that has formed here. And you can see you still have some blisters. We call those bullae, right? And then you've got the deep, dark red. It's okay if I touch your...
Yes, sir, that's fine.
Since I know... Hey guys, again, Dr. Gilmore here, Monday morning, the 12th of November. I just wanted to give you a follow-up on Becca. And note to my editors, please include a little video of that. I'm sure you will, so you can do that. But here's an update that everybody wanted to know. And what we played the game Guess the Rash, because this was a patient who came to us after they'd already been to an emergency department and then was sent to a dermatologist, and was misdiagnosed in apparently in both places. The first place, they thought she had an allergic reaction, and they gave her a low dose methylprednisolone pack, and it did absolutely nothing for her, but was given a referral to a dermatologist. Dermatologist stopped the steroids and ordered a biopsy, which may or may not have been helpful, but apparently put her on some kind of topical product. I don't know what it was. And she came to me out of frustration after about 3 weeks of this ordeal. Of course, I recognized that she, and I'm going to let the cat out of the bag, what she has is HSP, Hemlock-Schönlein purpura, which is a very serious disease, not from the rash standpoint, although it looks remarkable from the rash. It's actually a very serious kidney disease. And so it requires high-dose corticosteroids, high-dose prednisone, which is the prescription that I gave her before she left. I said, go get this filled, and I want you to get over to see the nephrologist today because they're going to want to do tests, possibly including a kidney biopsy. Which she followed those instructions, and we did get the consultation note back from the nephrologist, and his number one diagnosis, I believe this was a him, and I hate to take that for granted. I'm not going to. Let's see. This is a doctor named Rupi, and I don't know if that's a male or female name, and so I apologize. But Dr. Rupi. Number one diagnosis was glomerulonephritis, which is my concern too, which was the kidney problem. That was the underlying problem, and so as ordered just a huge panel of tests to find out exactly what's going on in the kidney, and then the number two would be the Hemlock-Schönlein purpura. And if you're a nephrologist, you always put the kidney diagnosis first. That's your job. But this nephrologist also increased the steroids even more than what I had prescribed. In fact, I had started out at let's see, I started at 40 milligrams on the first 5 days, and so what he or she did was continue that for longer than that time period. But so we got her taken care of, we got her head in the right direction, and we're going to see if we can follow up with Becca down the road. So this is a very interesting case. This is not the kind of case that a primary care physician sees on a regular basis, and as you can tell, not very often wanders into a dermatologist's office or into an ER for that matter. It's a very unusual case. So we got Becca headed in the right direction, and we'll follow up with her later and see if we have any other information for her for you guys. Thanks for following along.